Hello, everyone, and welcome to Parkview Health. I'm Curtis Smith, the Corporate Director of Community Engagement for Parkview Health. We are here today to have a conversation about COVID-19, and we're having a conversation based largely around the questions that you have been asking us. The community, our partners, those we collaborate with, have been writing us, calling us, expressing concern about all that's going on around the coronavirus pandemic. And so we want to address some of your questions and some of your concerns. Today, we are in the Miro Center here in the Grand Hall South, which is not a television studio, certainly, but we have made it into one so that we can have a little social distance between each of us and that we can answer your question in a form that will get those answers to you as quickly as we can as we turn this around through the magic and the power of video. We're going to have a panel discussion of sorts today with four folks, two at a time. And first joining us is Dr. Joshua Klein. He's the Chief Medical Officer for Parkview Physicians Group, and Max Mail, who is the Vice President of Virtual Health here at Parkview Health. Let's start with you, Dr. Klein. I've got questions that have been submitted to us. First, just take us through the basics of COVID-19. What is the coronavirus? What does it look like? What are symptoms that show up for people who have the virus?
Thanks, Curtis. I appreciate being here today, and these are great questions. So COVID-19 is a new novel coronavirus. Coronaviruses are cold-type viruses that have been around for a long time, and this new novel coronavirus, unfortunately, is quite a bit more aggressive than the coronaviruses we've seen in the past. So I think the most important thing with this is what are the symptoms of COVID-19, and then how do we differentiate that from other things that people might have that might cause cough or cold symptoms? And sometimes that can be challenging. So symptoms of COVID-19 include fever, and we define that as 100 degrees Fahrenheit or more, cough, sore throat, potentially shortness of breath, and then other symptoms that we can see that are less common but possible include nausea, vomiting, muscle aches, sometimes diarrhea, runny nose, headaches, and sudden loss of smell or taste. So the difference really is if somebody has just a cold or allergies, you tend to have kind of the same thing you have every spring. You might have itchy eyes or runny nose or cough, but you don't really feel that badly. And a way to differentiate that would be, is this something you have every spring? So with COVID-19, we'd expect that you'd feel badly. And you know, it can be a little bit challenging to tell this from common colds, but we know from our data in this area that influenza and most of our other viral causes of colds has gone down and COVID-19 has gone up. And so we assume at this point that if people feel badly and have cold-like symptoms that they have COVID-19.
We hear a lot about those with weakened immune systems, the elderly, the very young, being more susceptible to the virus. Is it truly that they're more susceptible to the virus, or that when they get the virus, it is likely to have a worse impact on them?
So that's a really good question. So we don't totally know the answer to that, Curtis. I would say the one thing that you mentioned of a group that's not at much risk is the younger patients, which is a wonderful thing in this case. So our kids typically are really spared by this virus, but it is mostly our older folks, 65 and older, and then people with multiple comorbidities or that might be immune suppressed. So when I say multiple comorbidities, things like heart disease, COPD, asthma, diabetes, things that many of us have, and that does put you at higher risk. We believe that that's because of how the virus acts on their immune system and differences in their ability to fight infection.
Let's talk about protection. We have, I think over the last several weeks, seen more and more usage of masks. We had several questions actually come in from employers that we work with saying, should they tell their staff, their teams to wear masks? What is the benefit of a mask? How can we protect ourselves?
Absolutely. So great question, and there's been a lot of questions about masks. I think that's really kicked up a notch since the CDC recommended a week or so ago that everyone wear masks in public. So what we know is there's no good evidence-based reason for employees to wear an N95 or a surgical mask like we would in a medical setting. But we do know that wearing a mask theoretically helps a healthy person prevent transmitting infection to another healthy individual. So in other words, the mask really helps you protect others more than yourself. And so if we are all masked as coworkers at an employment site, that really helps us all protect each other. By if somebody coughs or sneezes and is wearing a mask, it prevents the droplets from going through the air, and it prevents it from getting on any surfaces around, and that helps to protect everyone. So again, we would recommend wearing masks as long as it doesn't get in the way of essential job functions. And in those cases, we'd be happy to talk to any of you more about how that might work. And I would also just say it would be very reasonable for folks in these settings to wear cloth masks. There's really no reason to wear an N95 or a surgical mask, and those are best left to healthcare professionals given the overall shortage of masks.
Right. Let's talk about testing. We've heard a lot about in the media about the availability of testing. What is the state of testing availability in our area? And then there's been some concern about if an employee has a test, should an employer be able to access the results of that test automatically? What does that relationship look like? But start with the availability of testing in our area.
Yeah, these are all great questions. So the availability of testing was extremely limited at first. It's now gotten better. And so we'll talk a little bit about what tests are available. I think it's important for people to first know there are two different kinds of tests that are talked about now. One is called an antigen test, and the second is called an antibody test. Currently at Parkview Health, we just have antigen testing, and so I want to talk about that first. An antigen test is a test that's done by a nasal swab and basically is only positive if the patient is actively shedding virus at that point. The challenge with that test is for about 3 to 4 days when somebody first gets the infection, they may not shed enough virus where they could have COVID-19, but the test would still be negative. And so testing in that time frame can give people a false reassurance that they're negative for COVID-19 when they could in fact have it. The other thing we know about tests is, unfortunately, these tests are not perfect. And so they're not always positive when someone does have COVID-19. So, at the end of the day, if you believe they have the symptoms of COVID-19, as a healthcare team, we're going to treat them like they do, even if the test ends up being negative. So the one question that comes up frequently is, why aren't we testing more or testing everyone? And the reality is, in many cases, it doesn't change what we would do, whether that's one of our own employees at Parkview Health or one of your employees. So personally, for our employees at Parkview Health, we use a symptom-based return to work strategy. And we'll talk a little bit more about that in our next question, but we don't test all of our healthcare workers that have been exposed if it's not going to change the outcome. And so you may find that if people are sent here for testing, that we may say they don't need testing, but here's our recommendation for their return to work. And that doesn't mean that we're trying to be stubborn. It just means we want to do the best thing to protect your employees and your other coworkers, similar to the way that we would protect our own coworkers here at Parkview Health. I think, in addition to that, the antibody testing that we're hearing a lot about now is a way to tell if someone had infection in the past. And we know there are some challenges with that test and things we're still figuring out to know how accurate it is, whether people actually do have appropriate immunity to this test or to the virus, and how good the test is for that. And so I think that you'll hear more about that in the next few weeks.
Let's talk about being in contact with someone who has COVID-19. If you have a family member, a friend, or you have knowingly come in contact with someone who has the coronavirus, what do you do? What is the proper amount of time to stay away from work and to stay out of contact with other people?
Yes, this is a challenging area, and it's got to be very difficult for all of you as employers. The guidance on this continues to change, so up until April 9th, the answer would have been that person is out of commission and out of work for 14 days. So on April 9th, the CDC updated its guidance in coordination with CISA regarding essential critical infrastructure workers. And what they said at that point is folks that are potentially exposed to COVID-19 can return to work as long as they remain symptom-free and employers take some additional precautions. So those additional precautions are that the employer should seek guidance from their occupational health program in navigating return to work decisions, and the employer is asked to clean and disinfect all areas such as offices, bathrooms, common areas, and shared electronic equipment. And the employee is recommended to self-monitor, including daily temperature if they're able to do that, and also just monitoring themselves for symptoms and let their employer know right away if they do have any symptoms. And certainly at that point, when symptoms develop, they should stay home from work.
Absolutely.
Yeah, and so, really with the folks that are returning to work, we want to make sure they do a couple things too. We want to be sure they mask, we want to be sure they maintain that social distance, and if they do develop symptoms, we want to be sure that they follow a symptoms-based return to work, meaning after the symptoms start, there should be at least 7 days from symptoms for them and them returning to work, and it should be at least 3 days or 72 hours since they've last had a fever without fever-reducing medications and since their cough and other symptoms have resolved.
All right. Dr. Klein, thank you so much for sharing those thoughts with us today. Great thoughts there as we all continue to deal with this very fluid situation, and it changes all the time. And speaking of change, I want to reintroduce Max Mail, our Vice President of Virtual Health here at Parkview Health. Max, the world of technology changes all the time anyway. Over this last month or so, we have seen it change in incredible ways. Can you just briefly give us an overview of what you've seen as you look across the virtual landscape, not only Parkview, but the world? It has been such a radical change.
Yeah, I think some of the discussions we've had is we've seen years worth of progress in the telehealth or telemedicine front in a matter of a month. I think rapid adoption by both providers and patients alike in an effort to keep everyone safe, in an effort to keep everyone isolated and yet still being able to receive care or continue on their care plans. So we've really seen the growth of telemedicine through this time and the growth of home-based care solutions.
Wow. As was the case with Dr. Klein, we've received a number of questions from those we partner with out in the community, and so I want to read a few of those to you. One is, what options is Parkview now offering to triage and the virtual diagnosis and treatment of COVID-19 symptoms? Let's start with that one.
Okay, so right away, Parkview began offering triage options. So on really day one of the crisis, our Parkview Physicians Group opened up a triage line, which is staffed by nurses. So you can call in and have a free essentially triage with one of our nurses to go over your symptoms. That's a 877-PPG Today number, and they can call into that. I think it's 24/7 as well. So that's our first step. There are also self-triage mechanisms on our website. In fact, there's a new option just released today that was put out on the website that patients could go in and evaluate their symptoms through a self-triage option and figure out where they should go for care after they input some key questions. We think those are great solutions to start with before you go rushing out to have a visit with one of our providers. Once you kind of walk through those steps and maybe you are sick or you do have some continued questions from there, we would recommend a virtual visit, and there's a couple ways to do that. We have a number of solutions with our Parkview providers. And we also have retail options available if you're out of the state of Indiana or if it's late at night. So we have several different mechanisms we can go through, and we'll go through those in detail, I think, in a few more questions.
Yeah, so let's talk, kind of the second half of this first question that we received was about being in contact with someone. We heard Dr. Klein talk about the protocol, but where should someone go if they want to be tested? ER, Ogg Health Clinic. Obviously, at that point, the virtual world might not provide quite enough and you need something in person, where would you take that next step?
Yeah, totally true. I would emphasize what Dr. Klein's sharing, which is we're not just handing out test kits. So definitely need to be seen in some capacity in order to get a test done. So with a virtual visit, we can determine if that's the next step, as well as we could even refer you to a respiratory clinic. We're not going to charge you for both visits. So if someone does see you virtually and thinks that a hands-on approach, or we need to hear something hard or long or something like that, we can send you to the respiratory clinic, and the virtual visit charge will not apply. So I think that's important to know, as well as you can go to, like you mentioned, some of the solutions, the ER or the OCHealth option. But I think a great solution is where PPG has stood up a couple of respiratory clinics throughout our communities, and that's an excellent option for patients to be seen. I do know that IV Tech, I believe, has a parking lot where they're doing some drive-through testing. Again, they're not just handing out tests in those scenarios, so they do walk you through the same algorithms that our triage lines would walk you through. And then if it's determined that you are likely to have COVID, then we would run you through a test at that point, or IV Tech would.
You've mentioned the phrase virtual visit several times through MyChart. Tell us about the difference between that, MyChart, and Parkview On Demand, both in terms of the experience of the two, but also in terms of how they're billed and how that impacts our patients.
Yeah, excellent question. So, because I think the build is very different in the two. So, the one thing we did in response to the crisis was enhance some of the features with MyChart and really create an ability to see your own provider in these cases. So, the MyChart options act just like it would if you are going into a Parkview clinic. So it's insurance-based. We run your insurance through that, and everything is billed as it normally would in person. So we have a few options, just like we have physical options. We have a virtual clinic option, which is it's not going to be your doctor that's seeing you or your provider, but it's the next available provider. So if they go into MyChart for that, they would click on Talk to a Provider, and that puts them into a waiting line, essentially, and the next available provider will grab them to be seen. And that, again, is all billed just like a walk-in clinic would be billed. We also have a Talk to Your Provider option, which is your own doctor or advanced practitioner, and you simply call our Parkview number to schedule an appointment and ask for a video visit with your provider. So that's great for follow-up care, or if you're maintaining a care plan, or if you just want to be seen by because you're sick, by your normal provider. So that can be done. There's a little appointment option in MyChart to do that. Lastly, so Parkview On Demand is a great solution it's built differently. And the reason that we always have had this before is that until the COVID crisis, we couldn't really drop insurance charges for patients to home. So it wasn't like we just came about last month to do this finally. This was never really an option for insurance-based programs. So once we were allowed to do that, we created that mechanism. Parkview On Demand has always been here for about 3 years as a retail service. It's a $49 visit. It's not the same as seeing your provider, but it does cover kind of walk-in clinic type symptoms for that $49. And a couple of differences with that is it's 24/7 and it's available through all 50 states. So you can really use either option. And if employers are wanting to provide a reduced rate or some sort of coverage for their employees to go be seen, they can use Parkview On Demand and have the employees turn in those receipts or whatever for reimbursement through their plan.
Let's talk about technology, Max. I don't think of myself as being that old, but I have already reached the stage where my kids use words about their phones that I have no idea what they're talking about. They can run circles around me in the technology world. For those people who don't know everything that their phone can do and don't have maybe the latest and greatest computer, are there concerns about what kind of equipment you need, a computer or a phone or a special download to access all that we're giving them through Parkview?
That's a great question. You don't have to have your own TikTok dance to know how to do this.
Good, because I don't even know what that is.
Our number one recommendation for the best experience would be to download the app. So a few key reasons why we recommend that, and that is, number one, very easily, everyone knows how to turn up the volume on their phone. Most people are very familiar with doing a video visit of some sort with a friend or grandchildren or whatever it may be. So turning up the phone, putting it on mute or taking it off mute, using the camera and flipping it around, we find that that's just a better experience with the app. With computers, we can do it on computers as well, but browsers and what operating software you're on, whether or not your camera is covered or working or the microphone works, that all gets a little iffy, and it's really hard for us to troubleshoot the vast number of combinations out there. So the app is available for both Android and Apple phones. Patients can go in and create it. It's very simple to use.
What about for someone who needs to receive care from a doctor? They either feel like it needs to be done in person initially, or it does end up that they do need to come in and see the doctor. Coming to the office, is that still a good option?
Yeah, potentially. I think what we would recommend at this point is that you call your office and talk through that with them. We really have a lot of our clinics right now are closed in order to keep everyone safe, but they are still seeing patients with video visits. And so they've been able to do a lot of different types of coverage through the video sessions. And so I think first and foremost, I would call your provider and ask them, share what your symptoms are and what you're going through, and let them kind of be the expert to triage you whether or not you should come in. A lot of cases, they may just suggest we do a video visit with you and handle it over that.
A phrase I hear a lot lately is there's going to be a new normal.
Yeah.
Things are going to change. We're going to have a new normal going forward. And one of the ways that I think some folks are concerned about it is, will this become the new normal? Will this virtual health aspect become the new normal? I know it's something that you guys are always working on and tweaking, and it existed before COVID-19. So as you look beyond the COVID-19 situation, will we continue to do all of these virtual health visits? Will we be doing on demand and MyChart? Will it be as robust as it is right now? What do you think that new normal looks like through technology?
Yeah, I mean, certainly in the role that I'm in, I've always hoped for some advancement of virtual health. I didn't think that would come at the expense of closing our clinics.
Right.
So this is not the new normal we wish for right now. But I think certainly there's been a lot of adoption both from patients and providers for it, and I think it has a place to continue alongside of our in-person visits. So I think there's a lot of convenience aspect for it that patients and providers both are enjoying, and we're still able to treat a lot of symptoms and cases this way. That probably all needs to be worked out as far as what should be treated virtually and what really is an in-person session.
But Parkview is committed to this technology. It's something
Absolutely,
that, again, we
yes.
did before COVID-19,
Yes, right.
and it's not like we're going to let this go away.
Absolutely, no. This will be a kind of a new part of your care options with your provider team, I think. And the questions that are still kind of lingering out there. So a lot of this came about as the government provided some waivers and loosened some restrictions around this. Like I mentioned before, we really couldn't bill insurance options for this previous to March. And so when all of this kind of settles out, it'll be important to see what reimbursement options they're providing for our clinics, and if they allow some of this to continue. So, but this is absolutely a vital part, I believe, in delivering care for Parkview's future.
Okay. Max, thank you so much. Dr. Klein, thank you so much. Because of social distancing, we're keeping just a couple of people to the stage at a time, and so we're going to take a quick break to transition, and as we do that, want to put our website on the screen for you, parkview.com. Right at the top of our website, we have a big banner stretching across the entire site that will take you to all the COVID-19 resources that you need online. And it is a tremendous resource, things about testing and symptoms and all kinds of great information there at parkview.com. When we come back in just a moment, through the magic of television, we will be joined by Dr. Michael Knipp and Dina Jackway. And welcome back. After a quick break to change sets, we are here with Dr. Michael Knipp and Dina Jackway. Dina is our Chief Community and Human Resource Officer, and we'll talk with her in just a moment. We're going to continue the conversation first with Dr. Michael Knipp, who is board certified in occupational medicine and is the medical director for our 13 occupational health clinics here at Parkview Health. Dr. Knipp, thank you for being here. In the midst of this COVID-19 situation, again, we've had a number of questions coming in from people all over the community. And the one I want to start with is about someone who might have COVID-19 but does not see a doctor, has some of those symptoms. Do we allow them to come back to work at 24 hours, 72 hours? Is there a safe time frame to allow them to come back without that input from a doctor?
That's a really good question, Curtis. I think right now it's hard to find the same answer everywhere. It's like trying to drink from the fire hydrant with a very small cup. That question I'm getting a lot to say basically who can return to work and when. So I thought I would just talk a little bit about that whole return to work process that could help employers. Anytime someone's ill, especially with COVID here, there's really 3 decision points we want to think about. It's the come or stay at work decision. It's the what to have that employee do during the time they're recovering, and then what is their path to return to work. So obviously some things guide us, like presence of illness, some of the symptoms Dr. Klein talked about, and letting the employee know your care options during that time. That, I think, has been covered by Max and Dr. Klein pretty well. The return to work is where it gets a little confusing, and I empathize with employers and employees. So they really need to make sure we're in the recovery stage. Dr. Klein mentioned the CDC guidance, and I've kind of repeated this many times. I'm calling it the 772 rule. It's the 7 days from symptoms, 72 hours recovered. That sort of guides things because in our practice, we really want to see patients once they've met that criterion. Do they need to see a physician? We guide employers to look at their own return to work policy. Many of them do not require an employee to seek medical care at all, or if they've been ill, they should go to a physician. There are many more options right now, for example, what Max talked about with the virtual options. The factor that's coming into play as well is access to care. As we know, many employees' private physician is not seeing patients currently. So I think it's a good idea to see a physician and have that return to work note. But for example, if you had been off and your employer sent you into our health clinic, even with or without that physician note, we would do an assessment to make sure you were okay to return to work, focusing again on that 772 rule.
Okay. Let's talk about someone who has COVID-19 and they are at work. Should everyone who works with them on that shift in that setting be quarantined? How alarmed should they be that they have worked with someone who has COVID-19?
I mean, that's one of the key questions we're still trying to get a clear and consistent answer out. The short answer is you don't need to quarantine everybody.
Okay.
It's really, to me, a part of a larger framework question of how do we keep our workplaces optimally safe and minimize exposure.
Right.
Before I forget, I wanted to mention a very good resource. It's from OSHA, and so that would be osha.gov. Okay. It's the 3990 document, and it's specifically regarding preparing workplaces for COVID. And the basic framework there is an employer could access this document, find their exposure level. For example, a high exposure area would be a healthcare facility. On the lower end would be, let's say, just a basic office. And it would be a place to guide them through different strategies to optimize keeping their employees safe and minimizing the exposure. Some of these things are already in play. Elimination strategies like the hand washing, deep cleaning, those sorts of things, and having ill coworkers not come in. Some other things you're seeing that fall under isolating workers from the exposure, like at the grocery stores, they're putting up the plexiglass shields. There's a category of administrative controls, which is how you change the way people work. That's the very robust telework phenomenon going on. Keeping socially distant at the workplace, no matter if it's break room or in the office space. The other main strategy, which everyone is, I think, familiar with, is the personal protective equipment, or the PPE, as it's called. And there are a lot of choices to be made there. But the basic idea is to look at that framework and decide what fits your employer solution best. This still also falls back to our 772 rule to say if we know someone had COVID and was at a workplace, really another rule is asymptomatic coworkers can remain at work. You know, we're looking at kind of a similar to the way we were, let's say 8 or 9 months ago. Someone calls in and says, hey, I have the flu. We wouldn't immediately send everyone home unless they were ill appearing. Because obviously if someone's ill appearing, they can be more likely to spread it.
Let's talk about workers' compensation.
Sure.
In terms of being exposed, you don't have it yourself, but someone perhaps has exposed you to COVID-19. Are you going to be covered by workers' compensation?
You have all the key questions, my friend. So that is another one that has come up. And luckily, and again, I'd like to reference OSHA. They just put out a notice on the 10th, which I would heartily encourage all of our employers and workers to go to that website and take a look. To just briefly summarize it, they do have specific criteria that have to be met for a COVID-19 exposure and someone developing COVID-19 to be considered work-related. And I'll let everybody look at those specific criteria. But what OSHA also has done, in my opinion, is they have separated employers such as healthcare facilities, correctional, and first responders to say, you still need to focus on making that difficult as it may be, that work-related decision right now based on those criteria. If you're not in those employer sectors, they're less focused on having you make that tough work-relatedness decision. They're more focused on, as you'll see in their announcement, keeping your employees safe and well, which is a good thing to have them support.
Sure.
So at this point, there is a pathway where it could be considered work-related, I guess if I had to summarize. But that guidance document is going to, I think, be very accessible to help walk employers through that process.
Okay. Let's talk about something I think that has been one of the bigger medical concerns. What about other things that aren't COVID-19 related? An injury, an illness that has nothing to do with the virus, might send someone into an Occ Health clinic,
Sure.
A sprain, a laceration, whatever. How are those situations being handled? What's the timeliness for those occurrences?
Of course. Well, we are happy to evaluate and treat injuries still at this time. Our clinics, the Occ Health clinics, are considered clean clinics, meaning we have generally healthy people that are coming into there to protect our coworkers and any patient that comes into our clinic. We're, of course, following standard CDC guidance with hygiene and cleaning and those sorts of things. So they would still be welcome. They don't need an appointment for an injury. They would just come on in. On the things opposite from injury care, we're also still doing what we call pre-hire services. So I know a lot of employers are in the process of converting manufacturing over to different things right now to support infrastructure. We are happy to help get their folks hired and onto the work line at this point. Again, generally no appointment needed, but appointments don't hurt on the employer services side, like the pre-hire physical or something like that. I would like to note, I think they mentioned the respiratory clinics with Dr. Klein. 3 of our clinics in Archbold, Wabash, and Huntington have been converted over to respiratory clinics, so we're at this time unable to see Occ Health patients there.
Okay.
But our call center is happy to assist with directing employers and patients to the nearest location to get the services they need.
Because we still have plenty of options.
Plenty of options here in Allen County and in the surrounding counties as well, yes.
Okay. Let's talk about diligence. I think as organizations, we certainly have a wide range of people who are incredibly sensitive to taking every precaution and some who aren't. And certainly as individuals, we all have a different sensibility about that. Let's talk about setting up things like temperature scanners and being prepared when people show up to work. how diligent, how cautious should we be to make sure that we're doing all we can proactively?
Of course. So that touches upon, some recent guidelines or recommendations that I think have come out that people are familiar with from the government on essential workers or critical workers, which I'd like to say, if you're working right now, you're obviously essential and critical. That's a message that's, I think, easily understood.
Yes.
I fielded this temperature screening question from a couple employers, and I like to work with them to understand what are they trying to accomplish with doing it. As Dr. Klein talked about, it's not easy to pick someone who has COVID apart from someone who has allergies or something else that could cause a low-grade fever. And that's what a temperature screen is intended to find, is find someone with a fever, not to diagnose what's causing that fever. Some of the guidance that I've been a part of is a work group here at Parkview Health developing a response to that key question, is should Parkview Health or another employer, be it a grocery store or a manufacturer, should they be screening their employees prior to them being allowed to enter the workplace or right when they enter or something like that? I do have to put the caveat in to say if it is a corporate policy that says, yes, you have to do it, of course you have to follow corporate guidance. I would like to give the medical side to this question. I'll defer to Dina's expertise and insight if there's an HR lens that could be played on this question as well. But back to the medical side, the research that we found to make our evidence-based recommendation unfortunately shows that really for COVID specifically, there was a paper out of University of Chicago, January, February, that says it's largely ineffective on detecting people with active COVID disease. So that becomes a factor in as much as can you even find what you're intending to try to prevent to come into your workplace. We do know from recent guidance from the EEOC, employers are allowed to check a temperature, as that does follow under a medical examination, and normally that's not permitted. But there's been a special concession made once it was declared a pandemic. It's additionally complicated by the fact that this will use scarce protective equipment supply, other supply use. It will require a daily medical examination that would put the screener at risk of being exposed, because to even use the most, I guess I'd call it socially distant method, the handheld scanner, you still have to get pretty close to ensure that you're using the instrument accurately, that it's going to give an accurate temperature. So there's the factor of it's engineered in, very difficult to remain socially distant, doing the handheld, let alone an oral or possibly an ear scanner. The other complicating factor is this is protected health information from a medical exam. To make a remain at work, present to work decision, that has to be documented somewhere, and then like any other piece of medical information, managed, protected, and disposed of appropriately, just like blood pressure or a medicine history or something like that.
So if someone's running a fever, it's hard to just make a blanket statement of saying, oh, you have a fever, you need to stay away for 24 hours, 72 hours, because it is protected information.
It would have to determine as a standard policy in the company, if the CEO or owner walks up and has a fever, they have to be treated just the same as someone who's it's their first day on the job. Plus, how does the employer, how can they demonstrate or show that information was appropriately protected and used in the appropriate manner, considering it's someone's protected health information?
Okay. Dr. Michael Knipp, board certified in occupational medicine. That is incredibly impressive and very important at this time as you lead our 13 Occ Health clinics. Thank you for being here and providing so much great information.
Happy to do it. Thanks for having me.
Yeah, absolutely. Let's transition to Dina Jackway, who is our Chief Community and Human Resource Officer at Parkview Health. Dina, you get to oversee all that we do in the community, which is vast, but today mainly wearing your human resource hat here. This might be some of the most difficult stuff to talk about with the coronavirus, because how people react to this, there is a wide range, to say the very least. how do you see morale among our Parkview coworkers? And then for those who are watching this who aren't part of our Parkview family, but are partners in our community, how do they help morale for their coworkers?
Sure. It's a great question. And I think as an employer, people are the most valuable resource that we have. And so because of that, everyone is unique. Everyone is going through things, not only at work a little different, but home. And so that just creates, even in normal circumstances, we all have very different things going on. So when you add in say, COVID-19, that just exacerbates the activity and the anxiety that can create. So as an employer, being able to connect, to simply connect with people and be able to find out what is a barrier for them, what are the challenges. Sometimes those very simple questions can produce so much so that you can help your workforce. It's such a powerful tool to have, asking curious questions, rounding, doing things so at Parkview, just announcing today, doing free meals for our coworkers that are on site and working. And why we want to do that is because, they're on site every day. We have about 4,500 people who are working from home, but so many others who are coming in each day. And so by doing that and by offering free meals, it seems small, it's a free meal, but at the same time, it's so powerful when it comes to the morale of our coworkers.
How important is it to be flexible? I imagine if I had said to you a couple months ago, hey, there's going to be a day right around the corner, we're going to provide free meals to all of our coworkers, you would have looked at me like I was crazy. Like, what? We're going to do what?
How are we going to do that?
No way on earth are we going to do that. But here we are, and we're doing it.
Here we are.
And so that ability to be flexible and to move with a very fluid situation, I assume in HR is even perhaps more important.
Yeah, so great lessons learned, I would say, over the last 30 days across this organization about being flexible. And when I put an HR hat on, flexibility has to be key, because the policies that we thought were important 30 days ago are not important anymore. We as a employer and I'm sure as others out there, relaxing some of those policies and saying, gosh, it doesn't make sense to have as stringent of an attendance policy anymore when we're going through something like this. And so we've looked at so many of our policies and we've said, A, I'm not sure this is important right now, and B, it may not be important on the other side of this anymore. And so flexibility is absolute key, not only as an employer, but as coworkers and what they're helping us do, because we have to move fast and we have to be very nimble.
I want to jump a little bit off script because something you said just triggered a thought. I talked about it with Max about this concept of a new normal. Mm-hmm. And I know that it's something that's on your mind. I've heard you use the phrase, there's going to be a new normal. We don't know what that's going to be yet, but as you think ahead to the future and try to prepare for a new normal, how do you position yourself well to be there to embrace that new normal and not run from it?
Well, I think I'll put the HR side of it on and say the things that we're doing today may not be as important. And so by going through times like this, you do realize the things that might be causing friction in your process that you can step back from and say, oh, we really need to not only do this different now, but we need to do this differently moving forward. And how people access information is different. How we get fast communication out to our coworkers differently than perhaps 30 days ago. And so it's really caused a lot of great questions, not really in any process in the organization, for us to say, could we do this differently in the future? Working from home, that's a perfect example. So with as many people right now as we have working from home, and we had to do that fast.
Right.
And by doing that, we had such great teamwork from our IT team and from our leaders across the organization to help build the infrastructure to make that happen and turn things on that we didn't have to use before. But now we have thousands of our individuals who are working from home and connected, and it's important for us as an employer to connect with them in a different way now because they're not physically here.
We have this great saying at Parkview, excellent care, every person, every day. It used to be every patient, every day, and we changed it to every person, and I think that's a huge and important distinction because it covers the coworker. It covers not just the patient, but their family, anyone visiting them. It covers everyone in our community that we come in contact with. And so as you think about that excellent care for every person, and in particular for our coworkers, dealing with their health, their well-being, their level of stress and worry right now, what kind of things have we put in place to help with that? What kind of things might you suggest for other organizations to look at?
I think the well-being of our coworkers is such a valuable thing to keep a pulse on. Having ears to hear is a really important way to focus, because it's picking up on some of what our coworkers are struggling with and what our challenges, because again, it's very unique for each coworker. Right. So being able to provide, and I'll give a couple of examples. So we had several of our coworkers who were having trouble sleeping. And we heard that, and we provided then an app that all of our coworkers could connect to, which helps them with anxiety and helps them with breathing techniques and helps them. And we simply reached out to an existing app that's out there nationally, Calm, to be able to do that and purchase a subscription so that all of our coworkers could use it at their leisure and at their times that they need it in their life. And so the amount of reaction from our coworkers for something that was an app and it was out there, but us being able to provide that at a time that they needed it, and because we heard it from them. So when I mentioned rounding a little bit earlier, I think that I realize not every employer is going to be able to go and round, and so I think another way that we set up here that has been useful for other organizations is setting up a dedicated email address for coworkers in the organization to send needs to send ideas, to send feedback. And that has opened up the doors for many of the things that we've now done here at Parkview, because we're hearing it directly from our coworkers instead of, well, let's think about what we think they might need right now. We're hearing directly from them and being able to quickly react and provide those.
I suspect more than ever, it takes a level of humility to be in HR right now, because sometimes I think we all, in whatever area we're experts in, we all think we have the answers, but being willing to listen, being willing to open those doors and let the coworkers speak into it is maybe a skill that's more important now than ever.
Yeah, I said it earlier, but having ears to hear, really being able to understand the challenges that coworkers are going through. And that, knowing about their family and knowing what they're struggling with, I think as an employer, that's important. Because at the end of all of this, post-COVID, wherever this ends up being and the new normal that emerges, our economy is going to be different, our workforce is going to be different, unemployment is going to be different, and I would think as an employer, the way we treat people now through crisis is absolutely going to be on their mind as it comes to other employers and choices that they will have in terms of where to go to work. And so that's important.
That is hugely important. At some point, the economy will come back to some degree and people will have choices again. Right now, that is a great pivot to our next question, which is about maybe organizations that are struggling to keep people employed, folks who don't have enough PTO, FMLA options, weighing those. What advice do you have to those organizations who are in that spot of how do we keep everyone on the books, employed, working, no matter what that looks like?
Yeah, so I mean, it's going to look very different, I'm sure, for each employer, but happy to share some of what colleagues of mine across the country and others and what we've done here. It really has to fit the organization and the culture, but as a great example, something as simple as looking at your PTO plans. And we elected to go into the negative. We elected so that coworkers did not have to choose between coming to work or staying at home when they should because they're sick, going back to some of Dr. Knipp's comments. Being able to borrow into your PTO bank so that you're not faced in that position. That's important. So we've opened up PTO to allow individuals to use that and go into the negative to borrow from that for the future. We've also taken a couple of old historic plans that we had EIP, which is extended illness, and we had about 2,000 coworkers who were eligible for it, but it was to use in very specific circumstances. And I've heard from other colleagues, they've done something similar, that they had these old historic benefit plans that you could only tap into for very specific situations. So we've relaxed all of those, and we've said, these are situations that you can open up and now begin to use those grandfathered hours or that frozen time that you had. Just another way to make sure that individuals can continue to be paid and continue to take care of their families.
Something else at Parkview that we pride ourselves on is world-class teamwork, and I know collaboration is vitally important to you, not just here inside of our Parkview family, but you collaborate and work with other HR professionals in healthcare and other industries as well. And I know that you are willing to share your email address because the exchange of thought is very important to you.
Absolutely. I think that now more than ever, and particularly in our region, we've had several organizations reach out to us and say, hey, what are you doing about this? And what does this look like for you? And I've gotten on several calls and texted back and forth with several. That's great, and I welcome individuals to reach out to me to do that, because we're all in this together, and I think we couldn't cover everything today, obviously, right. And so just being able to have a fellow regional contact to really talk things through with, bounce ideas off of, certainly want to be available for that.
And so your email is now on the screen. It's dina.jackway@parkview.com. Here's our big Parkview secret. All Parkview emails work the same way. First name dot last name @parkview.com. I hope I didn't just violate an HR
you just really
rule,
let that out.
I'll bet you could crack the code, though, by looking at Dina's email, dina.jackway@parkview.com. So if you do have thoughts, concerns, questions, Dina is always happy to collaborate. So Dina, thank you so much for sharing your thoughts with us today as well. And Dr. Knipp, thank you again for doing that too. And thank all of you for being with us and submitting so many great questions that allow us to have this important dialogue around COVID-19. As the situation continues to change, I think you all know this from your relationship with Parkview. You can trust that we are going to continue to change with it and address it as best we can. We are here to help you as your partners and as your collaborators. We hope and pray that you stay safe through these days and continue to stay connected to Parkview. Go to parkview.com, look at that banner at the top of the screen for the very latest on all the COVID-19 information. Stay safe.